So today I will be doing my presentation on the canine sacroiliac joint. So the sacroiliac joint is a key structure connecting the trunk and the pelvic limb. It is made up of the ilium, which is a part of the pelvis, and the sacral vertebrae. This forms the sacroiliac joint, and its structure is key to how it functions. So the first part of the sacroiliac joint is formed by the sacral vertebrae. So in the canine, it is formed by the fusion of the three sacral vertebrae to create one vertebrae. You can see here the structure of the sacral vertebrae. The auricular surface of the sacral wing is the part of the sacrum that forms the joint with the os ilium or the iliac bone. If there was a lateral view, if you rotated this structure laterally, you would be able to see the median and lateral sacral crests. So the secondary part of the sacroiliac joint is the os ilium. This is a very large structure. It has a large surface area for lots of significant structures, significant sites of attachment of muscles and ligaments. So as detailed here by the number 8, there's the body of the iliac bone, 10 the wing of ilium, iliac crest, tuber cocci, sacral tuber, cranial dorsal iliac spine, and the caudal dorsal iliac spine. So the bony prominences of 15 and 16 are the dorsal, cranial and caudal iliac spines, which their bony prominences form the sacral tuber. What you can't see on this diagram is the cranial and caudal ventral iliac spines, which bony prominences form the tuber cocci. The ventral iliac spines are very palpable on canines as canines tend to have large pelvises. The next structure is the sacropelvic surface and the Phys auricularis. So the Phys auricularis is the auricular, which is ear-shaped surface that forms the joint with the sacral vertebrae. So it's a very, very important part of the os ilium. So the sacroiliac joint itself is classed as a plane joint, which is a simple joint which involves the joining together of two surfaces, of which are the auricular surface of the iliac bone and the auricular surface of the sacrum, to form a strong joint which allows only a small amount of movement and which glide over each other. However, the SI joint is quite special in that both surfaces involved in the joint are irregular or irregular shaped, and therefore require things like ligaments and fibrocartilage to be able to give it stabilization and strength and to hold the joint together. The sacroiliac joint is also a synovial joint, and it has an enclosed joint space, and it's closed at both ends by bones, which are both covered in articular cartilage to create the joint space. These bones are obviously the sacrum and the iliac bone. Again, I'm at the point of how special a structure the SI joint is, as it requires extra ligamentous support because of the irregular surfaces of the iliac bone and the sacrum to form the synovial joint cavity. So these ligaments are the dorsal and ventral sacroiliac ligaments, with the short branches connecting the sacral tuber to their mammillary processes and the long branches connecting the sacral tuber to the lateral aspect of the sacrum. Another significant ligament is the sacrotuberous ligament, and this originates in the ischial tuberosity and inserts into the transverse process of the sacrum, which helps the stabilization of the sacroiliac joint. I forgot to, there we go, there are the ligaments. Other significant structures, muscles, which originate in this area are the gluteus medius, gluteus profundus, and tensor fasciolate, piriformis, and gluteus superficialis. The gluteus superficialis and the piriformis both originate on the sacrum laterally and ventrally respectively. The tensor fasciolate, it originates on the iliac spine, on the ilium. The gluteus medius originates on the iliac wing, and the gluteus profundus originates in the gluteal surface of the ilium. Additionally, the sacroiliac joint is innervated by the cranial and caudal gluteal nerves from the local regional gluteal muscles, but also by the dorsal rami of the first, second and third sacral nerves, and the dorsal root ganglia of the lumbar vertebrae 1 to sacral vertebrae 3. So the fundamental function of the SI joint is basically to connect the pelvic limb to the trunk. But also the sacroiliac joint is an amphiarthrosis joint, which basically means it's a joint that allows very little movement due to the connection of the bony surfaces, which in this case is the sacrum and the iliac bone. And these surfaces are joint through the use of ligaments and fibrocartilage, as the iliac bone and the sacrum have concave surfaces which are irregular, which require extra stabilization. But like I've said before, the main function is to connect the pelvic limb to the trunk and allow transmission of propulsive forces which are generated in the pelvic limb. So the forces travel through the pelvic limb, through the sacroiliac joint into the spine. So some common pathologies of the sacroiliac joint in the dog involve the calcification of the interosseous ligaments, and these are the ligaments, the dorsal and ventral sacroiliac ligaments. And the calcification can basically involve the ligaments hardening over time as the dog ages, which can cause soreness and gradually reduce the support of and stabilization of the sacroiliac joint. Interestingly, the study by Knaus et al. Found that larger breeds of dogs have higher forces exerted on the sacroiliac joints, as the ligamentous attachment sites are actually smaller in larger breeds compared to smaller breeds. Another common pathology also is the overextension and over-rotation of the sacroiliac joint region. This is common in agility dogs, and this is because of overextension comes from jumps, and as the jump height gradually increases, a study found that the risk of sacroiliac joint disease increases. And over-rotation comes from the quick lateral turns that agility dogs perform, and also increases the risk of sacroiliac joint disease, and also risk of the ilium being stuck at an angle in relation to the sacrum, which will cause soreness and lameness as well. And finally, another common pathology is quite extreme, which is the sacroiliac joint luxation, which is the dislocation of the sacrum from the iliac bone, and this often requires surgery and a long stint of rehab. Thank you for watching my presentation, and this is my reference list.